EMG question of the day. Which of the following spontaneous activities most likely represents a fibrillation potential arising distant from the recording site and captured by an electrode close to the surface of the muscle fiber? Please take a look at the figures below and select one, A, B, or C. We will start this talk defining spontaneous. In the EMG lingo, spontaneous means not triggered by the willful or unintended action of a patient. This definition is important because we include among spontaneous activity the muscle fiber action potentials triggered by the interaction of electrode and tissue. As you can see in this frame, featuring a photograph of the cross-section of a monopolar needle in a rat gastrocnemius muscle, when we introduce a needle in a muscle, the needle displaces and distorts the muscle fibers in its path. The fibers at the tip become markedly flattened and those a little more proximal compressed. In both cases, the tissue-electrode interaction can generate an action potential. Next, before jumping back to the chart we saw initially, I like to explain some basic concepts about electrical fields and the volume conduction hypothesis. This diagram represents the field distribution of a quadrupole in a large medium as created by a moving action potential in a muscle fiber. The red arrows indicate the flow of positive charges out of the muscle fiber. This flow adds positive charges to the extracellular space, creating a positive field called a source. The blue arrows indicate the flow of positive charges into the muscle. Subtracting positive charges from the extracellular space creates a negative field called a sink. Quadrupoles are made of two dipoles. The advancing dipole is denser, thus stronger, and expands further in the extracellular space than the trailing dipole. Unlike moving quadrupoles, static quadrupoles are constituted by symmetrical dipoles. They arise at the site of origin of the action potential. Now let's go back to the chart. Spontaneous single muscle fiber action potential can take the form of a positive sharp wave or take the form of a spike. There are three types of spikes. We will start by talking about triphasic spikes, the most common form of a spontaneous single muscle fiber action potential encountered in clinical practice. These figures represent an advancing quadrupole at the end of a muscle fiber. I have now introduced the tip of a needle. Initially, the quadrupole does not impact the needle because it is too far. The initial advancement of the quadrupole exposes the positive charges of the advancing dipole to the needle, producing a positive turn from the baseline trace. As you can see here, the quadrupole advances, and as the neutral zone of the advancing dipole reaches the tip of the needle, the wave returns to baseline. The quadrupole continues advancing, so the tip of the needle is now influenced by the sink of the advancing dipole. As this is happening, the negative stroke of the potential gains amplitude. Then the tip of the needle becomes exposed to the highest voltage of the quadrupole and the amplitude of the potential reaches maximum. As the tip of the needle becomes influenced by the sink of the trailing dipole, which is lower voltage than the sink of the advancing dipole, the amplitude of the tracing starts dropping, creating the downstroke of the potential. Once the neutral region of the trailing dipole impacts the needle tip, the tracing reaches the baseline once again. With further advancement, as the recording electrode is mostly influenced by the positivity of the trailing dipole, a positive wave is recorded, which is smaller than the initial positive wave because the source of the trailing dipole produces the weakest field of the quadrupole. Later, as the quadrupole advances and no longer its current exert influences on the tip of the needle, the potential goes back as indicated here. So we have talked about triphasic spike. Now we will look at the biphasic spike with initial positivity. In this frame, you can see the setting we just used to explain the generation of a triphasic spike. When we increase the distance between the recording surface of the needle and the quadrupole, as I have done here, all other conditions kept the same, the advancing quadrupole will generate a biphasic spike with positive onset. We will see how in the next few frames. At this distance, the advancing quadrupole does not influence the electrode. Hence, the tracing will be at baseline. Once it advances and the recording surface of the electrode comes under the influence of the positivity of the advancing dipole, a positive deflection occurs. When the neutral point is reached, the tracing goes back to baseline. Now, the electrode is confronted with the sink of the advancing dipole and the upstroke begins. Then, the quadrupole advances, posing the needle to the maximal negativity, which is expressed in the trace. As the electrode comes under the influence of the zinc of the trailing dipole, the tracing drops. Once the quadrupole advances and the quadrupole most influential activity is emanating from the neutral zone, the baseline is reached. Further advancement no longer influences the potential, because the positivity of the source of the trailing dipole is too weak to influence the tracing. So we talked about biphasic spike with initial positivity. Now we will talk about biphasic spike with initial negativity. In this frame, I have not represented a quadrupole because no action potential has been triggered. The tracing is recording baseline, reflecting the lack of any activity. If an action potential is initiated right under the tip of the electrode, a symmetrical quadrupole will appear, and the tracing will show a quick rise, as indicated here. The quadrupole under the needle then generates two quadrupoles that advance in opposite directions, exposing the electrode to the source of the trailing dipoles, and as the result, the tracing becomes positive. Further distancing of the quadrupole along the muscle fiber causes the return of the tracing to baseline, because the electrode is no longer influenced by the quadrupoles. So the answer to this question is C. Thank you very much for your attention.